Before we can even begin to talk about diseases, treatments, or really any kind of medicine, we have to start at square one, the normal, healthy human body. Seriously, understanding this incredible machine is the absolute foundation of all medical science. It's kind of like learning the language our bodies speak. So let's get started with the basics. This right here, this single idea, is the core of everything we're talking about today. Every single thing in medicine, whether it's reading an X-ray or performing heart surgery, it's all built on a deep, deep understanding of what's normal. So that's what we're going to do. Build that foundation together. All right, here's our game plan. We'll start with the two main pillars of medicine. Then we'll get into the difference between structure and function. After that, we'll look at the body's blueprint, learn its universal language, figure out how it stays in balance, and finally, wrap it all up by seeing why this is so critical in the real world. Okay. Section 1. Let's start with the absolute bedrock. The entire field of modern medicine, and I mean all of it, rests on two core disciplines, anatomy and physiology. Everything else is built on top of them. So what exactly are anatomy and physiology? Well, the best way to think about them is like two sides of the same coin. They're totally inseparable. You literally cannot understand one without understanding the other. One tells you what the parts are, and the other explains how those parts get the job done. So let's break it down super simple. Anatomy is the study of structure. Think of it as the body's blueprint. It's all about the what and the where. Physiology, on the other hand, is the study of function. It's the physics, the chemistry. It's all about how those structures actually work. It's the how. Okay, let's take the heart as an example. An anatomist would ask, what are its different chambers? How big is it? Where do the major blood vessels connect? This could be gross anatomy, which is what you see with your naked eye. Or it could be microscopic anatomy, where you're looking at its individual cells under a microscope. Now, let's flip that coin. Using that exact same heart, a physiologist comes in and asks totally different questions. They want to know, how does that muscle contract to pump blood? What are the electrical signals that make it beat? How do the valves know when to open and close? See what I mean? Structure and function, they're completely intertwined. Now, the body isn't just a random jumble of parts. It is so meticulously organized. There's a clear hierarchy, a ladder of organization, and understanding this is absolutely essential because a tiny problem at the very bottom level can cause huge issues for the whole system. So it all starts at the very bottom with atoms and molecules. That's the chemical level. Those then come together to form cells. Groups of similar cells band together to create tissues. Different tissues join forces to create an organ, like your stomach. Organs then work together in an organ system, like the digestive system. And finally, all those systems working together create the entire organism. You. Okay, to describe this ridiculously complex structure, we need a precise and, well, universal language. And this isn't just about memorizing a bunch of boring terms. It's a toolkit that allows doctors, nurses, and scientists anywhere in the world to communicate with absolute clarity. And the cornerstone, the absolute foundation of that language, is the anatomical position. This is the standard frame of reference for everything. The body is standing up straight, looking forward, arms at the sides with the palms facing forward. This is the universal starting point. And this shows you exactly why it's so important. I mean, think about it. A patient could be lying on their side or curled up or sitting in a chair. It doesn't matter. When a doctor describes a location on the body, they are always referring to it as if the patient were in this exact position. It just eliminates any and all confusion. So from that standard position, we get our directional terms. You can think of it like a built-in GPS for the human body. For example, the head is superior to the shoulders, meaning it's above them. The sternum is anterior to the spine, meaning it's in front of it. Every term is a precise coordinate, leaving zero room for error. And this is where this stuff becomes literally a matter of life and death. A surgeon can't just say, make a cut a little to the side of the belly button. No way. They have to say something like, make a 2-centimeter incision, 3 centimeters lateral to the umbilicus. And every single person on that team knows exactly what that means. This language guarantees precision when it matters most. Next up, we have body planes. These are just imaginary flat surfaces that we imagine passing through the body. A sagittal plane divides the body into left and right. A coronal plane divides it front and back. And a transverse plane divides it into top and bottom. So why does this matter? Well, because this is the language of medical imaging. When you look at a CT scan or an MRI, what you're really seeing is a series of transverse slices of the body stacked on top of each other. Understanding these planes is how you learn to read those images.
Okay, now let's see how this all comes together in a living, breathing person. The body isn't a static object. It's constantly, actively working to maintain a stable internal environment. And this incredible balancing act is called homeostasis.
Just think about it for a second. Your body temperature likes to hang out right around 98.6 degrees Fahrenheit, right? It doesn't matter if you're in a blizzard or a heat wave. Your blood sugar levels stay in a really narrow range even after you eat a big meal. That's stability. That's homeostasis in action. The body pulls this off using things called feedback loops. So, a stimulus, let's say a drop in body temperature, is picked up by a receptor. The control center, your brain, gets the message and sends a signal to an effector, like your muscles, telling them to start shivering to generate heat. And this leads us to one of the most fundamental ideas in all of medicine. So often, disease is simply a failure of homeostasis. All right, let's bring this all home. We've gone over structure, function, organization, and that delicate balance. So why is all this foundational knowledge so ridiculously important in a real-world clinic or hospital? Because you simply cannot practice medicine without it, period. To understand what goes wrong in a disease, you first have to know what right looks like. To perform surgery safely, you have to know the exact map of every nerve and blood vessel. To understand how a drug is going to affect the body, you have to understand its physiology. It is the language of both diagnosis and treatment. In the end, it's really this simple. Anatomy gives you the map of the human body, and physiology explains how that map actually works. Together, they aren't just subjects you memorize for a test. They are the very foundation for understanding human health and disease. So now that you know the language, the only question left is, what will you discover?